Prison reform concepts. Almost half of the prisoners in the United States have been diagnosed with a mental illness, which means that our jails and prisons have now become our nation's largest mental health providers. This country's prison population has also been growing steadily since 1990, with the incarceration rate of men rising 22%, and since 2000, the rate of women being incarcerated has risen an astounding 60%. Two-thirds of the inmates in state prison and 40% of those in federal prison have been convicted of a violent crime. Prisoners incarcerated in state prisons serve approximately 2.7 years behind bars, whereas those in federal prisons serve an average of 12.7 years. Housing these prisoners also comes at a tremendous cost. Each prisoner that we incarcerate costs the taxpayers approximately $65,000 each year. Every prisoner who has served their time will eventually be freed and allowed to re-enter society. Unfortunately, the vast majority of them will be reincarcerated once again. In fact, within 10 years of being released from prison, the reincarceration rate is a staggering 82%. The United States only makes up 5% of the world's population, yet it imprisons 20% of all the world's prisoners. This means that the United States imprisons more of its population than any other country in the world. You would think that with so many people in prison, the United States would be one of the safest countries to live in, but of course, we all know this is not the case. It should be clear to any reasonable person that our current prison system is broken and in desperate need of repair. Maybe we should think about changing the way we go about punishing individuals in our society that are a threat to our lives, our freedoms, and our way of life. It would also seem logical to try to figure out why our prison system does not work, and even more importantly, figure out what needs to be done to make it a more effective system. Before we can change our prison system, we must first change the way we think about prisons, prisoners, and how we deal with those who do not follow the laws we put in place to protect the rights and freedoms we have all come to enjoy. Our current prison system is based primarily on punishing those who break the law. Perhaps instead, we should strive for a new system of incarceration that focuses more on helping prisoners attempt to turn their lives around to become productive citizens before we allow them to re-enter society. We as a society should not accept the status quo, where our prisons have become nothing more than a revolving door where people go in, do their time, and get out, only to reoffend and go back to prison after causing further pain and suffering to the people of this nation. Instead, we should have a prison system where inmates will not be freed unless they can successfully demonstrate that they have become someone who will, at the very least, do the people of this nation no further harm. We do not need prisoners re-entering society intent on reoffending and ending up back in prison, continuing the seemingly endless cycle of committing a crime, being incarcerated, being released, reoffending, and then being reincarcerated. Maybe we should give prisoners an opportunity to make real changes in their lives instead of just locking them up and throwing away the key. Why not give prisoners the tools they'll need to successfully and safely re-enter society? Why not try to get them involved in working toward improving their lives? If prisoners are to have any chance of successfully re-entering society, they'll first need to transform their lives and their behavior in meaningful ways in order to earn the privilege of being released. A new approach to our system of incarceration. Our present prison system consists of various levels of incarceration, beginning with home confinement and electronic surveillance using ankle monitors. This form of punishment is usually reserved for those prisoners who pose the least risk. The next level of security includes honor farms and minimum security prison settings. These prisons usually house low-risk offenders. Next are medium and high security prisons, which tend to house more high-risk offenders. Then comes the maximum security and supermax prisons, which house our most dangerous criminals. This assortment of confinement options allows prison officials the opportunity to place each prisoner in a prison setting that matches their threat level. Being placed in a less restrictive prison setting is one way of encouraging prisoners to behave appropriately. Another way of motivating prisoners is to offer them an opportunity to be released from prison early if they simply follow the rules and behave themselves. This incentive makes sense because almost every prisoner wants to be released from prison as soon as possible. Although following the rules should not be the only criteria for early release, the ultimate goal should be for prisoners to make meaningful, positive behavioral changes before they are released from prison. There are also a series of escalating punishments that are used to manipulate the behavior of prisoners. These punishments range from increasing an inmate's sentence for various offenses such as fighting or threatening other inmates or simply breaking the rules. Prisoners can also be moved to higher security prisons or even placed in solitary confinement. The only punishment that may be worse than solitary confinement is serving a life sentence without the possibility of ever being released or to be given the death sentence and executed. Using solitary confinement and the death penalty as punishments both come with some very serious consequences. As human beings, we are by our very nature social beings. With this in mind, placing a prisoner in solitary confinement is cruel and unusual punishment. There may be certain instances when a prisoner's behavior is so horrific that they need to be separated from the rest of the inmates. But using solitary confinement as a long-term solution is inhumane and should not be permitted. One effective way of teaching our children to behave is to give them a timeout. Timeouts work by isolating a child from the rest of the children for a certain period of time so that they can think about what they have done and hopefully change their behavior. Solitary confinement is similar to a timeout, except the prisoner spends all their time isolated from their fellow inmates. Solitary confinement could be much more effective and humane if it were used more like a timeout than a long-term punishment. The death penalty is another type of punishment that should also be considered cruel and unusual. When our society puts a prisoner to death, we are no better than the prisoner we have executed. We are, in essence, behaving no differently than a prisoner who committed murder. Another issue concerning the death penalty is the finality of the punishment. Once someone has been executed, there is no going back. There have been many instances in which we discover an inmate's innocence only after they have been put to death. How can we ever be absolutely certain that we are executing the right person? The one that truly committed a crime punishable by death. Another punishment that prisoners must endure is being separated from the opposite sex. This form of punishment could also be considered cruel and unusual. Isolating men from women and women from men is not only an extreme punishment, but it's also rather inhumane and abnormal. Allowing men and women prisoners the opportunity to commingle could be used as a powerful incentive and motivating force to improve the behavior of prisoners. For instance, when a prisoner makes an effort to improve their lives and have made meaningful positive changes to their behavior, they could earn the privilege of commingling with the opposite sex. In addition to isolating the sexes from one another, another very serious and severe punishment that prisoners must endure is not being able to have a sexual relationship with the opposite sex. Since an inmate is restricted from having sex in prison, they may be highly motivated to get out of prison as soon as possible. To accomplish this, they will need to make positive, meaningful changes to their behavior. Another way to improve the behavior of prisoners is to employ a variety of behavioral modification techniques. These techniques have been scientifically proven to be an effective method of changing behavior. Society needs to be reassured that no prisoner will be allowed to leave prison until their behavior has improved enough to safely re-enter society. No one should be released from prison until they can demonstrate that they are truly ready to leave. This means that no prisoner will be released until they have made positive, meaningful changes to their behavior Unfortunately, this also means that some individuals may never leave prison. Since almost half of all inmates have been diagnosed with a mental illness, perhaps there may be a better approach to dealing with these mental patients than simply warehousing them in a prison cell until they serve their time and are released. Perhaps we should think about changing the way we go about treating prisoners with mental illness. If we are serious about helping prisoners and ultimately society itself, we should first diagnose and then treat any prisoner with an underlying mental illness. One of the first things that could be done would be to carefully evaluate each and every prisoner for psychological and/or psychiatric disorders before they enter prison. This way, we could better understand the psyche of each inmate, and with this knowledge, we could effectively treat their underlying mental health issues. This process will not be inexpensive or easy, but if we desire real change in the behavior of these prisoners, we must take this first step. To accomplish this goal, each prison would first need to hire a series of trained mental health professionals who would begin the process of conducting a complete psychological examination of each prisoner. These mental health specialists would start by giving each prisoner a battery of psychological tests and conduct a thorough, in-depth diagnostic interview. Once this psychological testing and diagnostic interview have been completed, a personalized treatment plan could then be developed for each inmate. This process would be completed for each and every prisoner as soon as they arrive at prison, whether they had been previously diagnosed with a mental illness or not. It would probably be safe to assume that if each prisoner were examined by a mental health specialist and properly diagnosed, the number of prisoners found to have a mental illness would very likely increase dramatically. After each prisoner has been thoroughly examined for any psychological issues, they would then be examined by a trained psychiatrist and, if necessary, diagnose and prescribe the appropriate psychiatric medications. This process of examining each prisoner for mental illness is vital. This is because an undiagnosed mental illness can be dangerous not only to the prisoner, but to everyone else as well. When a person with a psychological or psychiatric disorder has been properly diagnosed and given the appropriate treatment and/or medications, their behavior tends to stabilize and usually improves quite dramatically. After conducting a complete and thorough psychological and psychiatric evaluation of each inmate as soon as they arrive at prison, the next step in the intake process would be to evaluate each prisoner's physical health. Each prisoner would be seen by a physician and given a complete physical examination. The prisoners would also receive any necessary vaccinations, and they would be screened for infectious diseases such as HIV, tuberculosis, hepatitis, etc. With so many mental patients being locked up and placed behind bars, maybe our prison system should be modeled more like a locked psychiatric hospital facility than one that simply houses prisoners. Some people may not be familiar with how a locked psychiatric facility differs from a prison facility. Locked psych hospitals are designed to care for patients who are experiencing a severe mental health crisis. These patients are generally considered to be a danger to themselves or to others. Psych patients are usually placed in a locked psych unit for their own safety and the safety of society. They remain in the locked facility until they are considered safe enough to be allowed to re-enter society. These locked psychiatric facilities are similar to a prison in that both prisoners and psych patients lose something extremely valuable: their freedom. The freedom to come and go as you wish, the freedom to do what you want when you want to do it. Losing one's freedom is devastating. It's one of the most severe punishments that a person could ever experience and be made to endure. The difference between a person who is admitted to a locked psychiatric facility and someone who has been convicted of a crime is that a psych patient is not a criminal. Locked psychiatric facilities differ from prison settings in many ways. Patients in these locked psych units are not placed in a prison cell. Instead, they are assigned to a room with several other patients, which they are allowed to leave at their leisure. Lock psych units also use a variety of behavioral modification techniques such as positive reinforcement, incentives, and rewards, which tend to encourage both good behavior and healing among patients. Unlike prison, most locked psych units allow patients to smoke. Smoke breaks are used as an important behavioral modification technique to control the patient's behavior. For instance, before the patients are allowed to go outside and smoke, they must first take their medications. They can also lose the privilege of smoking if they misbehave. Patients are also encouraged to attend group therapy sessions where they are given the chance to share their thoughts and feelings with others. The main difference between prison and a locked psych unit is that prisons are based primarily on punishing inmates for their crimes, whereas psychiatric facilities promote healing among the patients. Another major difference between prisons and a locked psych unit is that psych patients do not serve a sentence. In fact, psych patients are usually not given any indication of when they might be released. Once a patient has been placed in a locked psych unit, theoretically, they could spend the rest of their lives there. These patients are not allowed to leave the hospital until they can demonstrate that they are safe enough to re-enter society. Being released from a locked psych unit and regaining one's freedom can be both an exhilarating and overwhelming experience. To ease this transition, patients are placed in an outpatient program designed to help them ease their way back into society slowly over time. It seems only logical that prisoners should also be given the same opportunity to attend a similar type of program that is specially designed to help them to safely transition back into society from prison. Being released from prison requires not only a different mindset, but also a whole new approach to living with all the responsibilities that come with being free. Again, the goals of a locked psychiatric facility and prison are very different. The primary goal of prisons is to punish inmates, whereas the goal of locked psych units is to offer patients a safe environment to recover from their mental health crisis. Perhaps we should rethink the way we go about punishing our criminals. Instead of simply locking them up, we might want to redesign our prisons to be more like locked psych units that promote healing and behavioral improvement. As part of their mental health screening, each prisoner would be evaluated for their potential danger to themselves and to others. Prisoners who present a clear and present danger to others would be placed in a special area of the prison where they would be closely monitored. These are not only the most dangerous prisoners, but they may also be the most difficult ones to treat. Prisoners who are diagnosed with a mental illness and are not considered a threat to others could be placed in a prison setting designed very much like a locked psychiatric hospital. These prisoners could be placed in rooms instead of prison cells. For those prisoners who are diagnosed with a mental illness and are considered a threat to others, they could be placed in a high-security psychiatric facility. These inmates would need to be placed in a prison cell for their safety and the safety of others. Prison cells would be reserved for only the most dangerous inmates. We could also separate those prisoners who are ready and willing to change their behavior from those who are unwilling or unable to do so. In other words, prisoners who are willing to put forth an effort to make real demonstrable changes in their life must be protected from those prisoners who either cannot or will not even make an attempt at changing their lives and seem content to spend the rest of their lives in prison. For those prisoners who are not yet ready to make the necessary changes to their lives, the path to freedom will remain open in case one day they have a change of heart and are willing to make an effort to change their lives for the better. The goal is to give every prisoner the chance and the opportunity to one day be free again. To do this, we must first create an environment in which prisoners are given an opportunity to change their lives and their behavior in ways that are conducive to one day being free. This new environment should be reserved only for those prisoners who are willing to take the necessary steps to improve their lives. In order to create an environment where this sort of change is possible, negative influences must be minimized or removed altogether. By separating prisoners who want to make real, positive, meaningful changes to their lives from those who do not, we'll hopefully give these prisoners striving for a better life a better opportunity to do so. Prisoners that demonstrate positive behavioral improvements could be moved from high-security prison environments to prison settings that offer inmates more incentives, opportunities, privileges, and freedoms. As the prisoner's behavior improves, their living conditions improve as well. They will receive not only more privileges, but also more responsibilities. Prisoners will be given a choice. They can either change their behavior in positive, meaningful ways and move toward eventually being released from prison, or if their behavior does not improve, they could spend the rest of their lives behind bars. The prisoners will be free to choose which option and ultimately which direction they wish to pursue. The fact is that you cannot force anyone to change their behavior. The only thing that you can do is give them an opportunity and the tools they will need to change their lives for the better. This will not be an easy process, nor will it be successful for every prisoner. The basic idea is to give every prisoner a chance to redeem themselves. This new prison system will give prisoners the opportunity to work their way back to freedom. One way a prisoner can do this is by participating in either individual and/or group therapy. Individual therapy sessions will be provided for prisoners who are most in need and will benefit most from this type of therapy. Group therapy sessions will be made available to all prisoners. These sessions will allow prisoners a chance to share their thoughts and feelings with one another and will give them an opportunity to work on any mental health issues they may be struggling with. These sessions will also allow prisoners a chance to share their emotional pain, which will help both themselves and others. Drugs and alcohol also play an important role in criminal behavior. Unfortunately, most addictions are very difficult to overcome, even when an addict wishes to quit. Two programs that have had success in treating addiction are Alcoholics Anonymous and Narcotics Anonymous. Both programs could be offered to the prisoners daily. Prisoners will be encouraged to attend one or both groups each day. If the inmates were to receive an education while in prison, they would have a much greater chance of being employed once they get released. Learning to read, write, and think critically are all very important and necessary components to living a life of freedom and responsibility. Offering inmates an opportunity to expand their minds and increase their knowledge would be a good investment for both the prisoners and for our society. If a prisoner is to remain free, they need to be employable. Prisoners could be given a chance to learn various trades such as plumbing, electrical, and construction. This could be done while they are serving their sentences so that when they leave prison, they'll be able to find a good paying job. While in prison, the inmates who are striving to improve their lives and hope to one day be released could also be given an opportunity to work. By holding down a job, the prisoners would have a chance to develop a strong work ethic, which would help them to both acquire and keep a job for the long term once they leave prison. If we are truly interested in reducing the number of people who end up in prison, we need to address criminal behavior before a crime has been committed. It would also be much more economical to prevent crime than paying $65,000 each year to lock someone up after they have been convicted of committing a crime. It would also be a good investment for this nation to try to help those who are in danger of becoming our next generation of prisoners. The vast sums of money being spent to incarcerate prisoners today could be better spent trying to improve the lives of those most at risk of ending up in our prisons tomorrow. Our nation's priorities seem to be misguided. Instead of spending vast sums of this nation's treasure locking people up, it would probably be wiser to invest in those who are most in need of our financial assistance and social support so that they do not turn to a life of crime. Another very troubling issue is the privatization of our prison system. Corporations have built private prisons that earn huge profits by imprisoning a large percentage of our population. These corporate prisons not only profit at the expense of the taxpayers, But they also take valuable financial resources away from more important and worthwhile programs that help make this country a better place for all of its people. This essay introduced several novel ideas on how we might reform our prison system. One of these ideas was not to release a prisoner until they have demonstrated that they are no longer a threat to society. Another idea was to evaluate and, if necessary, treat every prisoner for mental illness. Further, separate those prisoners who pose a threat to others from those who do not. In addition, separate prisoners who are willing to change their lives for the better from those who seem content to spend the rest of their lives in prison. And finally, offer those inmates who are willing to make an effort to change their behavior in positive, meaningful ways the opportunity to further their education, learn a new skill or trade, or to work while in prison.